Hello everybody watching this. Welcome to our new channel MediMadeEzy. We will be starting our first video with the topic thorax. The topic thorax will be dealt in 3 videos, making it easier for everyone to understand. Hope you like our video and gain some knowledge from it. And if you do so, please do like, share and subscribe to our channel. Okay, so this will be a first segment where we will be dealing with 3 topics. The first, thoracic cage; second, the thoracic cavity; and at last, the mediastinum. So let us begin with the discussion. Now let's start with the thoracic cage. Thoracic cage is an osteocartilaginous cage that helps in increasing and decreasing the volume of the thoracic cavity, which is very much required for the exchange of gases during the process of respiration. Talking about its boundaries, posteriorly we have the 12 thoracic vertebrae, anteriorly we have the sternum, and on the lateral sides we have 12 pairs of ribs. Posteriorly we have a joint where the rib attaches to the vertebra called the costovertebral joint. Anteriorly these joints are a little different. The first to the seventh rib attach themselves directly to the sternum with the help of a cartilage forming the sternocostal joint. The eighth to the 10th rib attach themselves to the 7th rib through a cartilage, hence not directly attaching themselves to the sternum. The 11th and the 12th rib are called the floating rib because they do not attach anywhere anteriorly, but they have a cartilaginous end. So it is clear from this picture that first to 7th ribs are called the true ribs because they directly attach themselves to the sternum. 8th to the 12th rib are called the false rib because they do not directly attach to the sternum. Okay, now coming to the contents of the thoracic cavity. As we all know, the thoracic cavity contains a pair of lungs, the right and the left lung, the heart in the middle, and down we have the diaphragm. We also see the entry of the esophagus and the trachea above. We have major arterial supplies and the venous drainage. Also, the thoracic cavity has lymphatic drainage and the nerve supplies. Okay, now let's move on to the inlet of the thoracic cavity. To identify the exact position of this thoracic inlet, let us set some boundaries. Posteriorly, we have the first thoracic vertebra. Anteriorly, we have the upper surface of the manubrium sterni, and on the lateral sides, we have the upper surface of first rib. Now let us talk about the contents of the thoracic inlet. We have the trachea and the esophagus. We have a major artery, that is the subclavian artery, and the vein, the subclavian vein. We also have two muscles, that is the scalous medius and the scalous anterior. Also, in this position, we see the apex of both the right and the left lung. Within the inlet of the thoracic cavity, we have a special structure called the scalene triangle. Talking about its boundaries, anteriorly we have the scalous anterior or the anterior scalene muscle. Posteriorly, we have the middle scalene muscle, and inferiorly we have the upper surface of the first rib, as we can see in this image. Talking about the contents of this scalene triangle, we have the brachial plexus and the subclavian artery. Now let's talk about the intercostal space. Defining the intercostal space, we can say that it is a space between two consecutive ribs. Talking about its contents, we have the external intercostal muscle, internal intercostal muscle, and innermost intercostal muscle. We have an arterial supply through the intercostal artery, venous drainage through the intercostal vein, and the nerve supply through the intercostal nerve. Next is our mediastinum. The mediastinum is a midline, narrow, and elongated space between the right and the left pleural cavities. It is connected to the lung on each side by the root of the lung. Talking about its boundaries, the mediastinum is bounded by the sternum anteriorly, by the thoracic vertebra posteriorly, and on the either side by the mediastinum pleura. The mediastinum extends from the inlet of the thorax to the diaphragm. Okay, now let's talk about the divisions of the mediastinum. Mediastinum is broadly divided into two, the superior mediastinum and the inferior mediastinum. The inferior mediastinum is further classified into three, that is the anterior, middle, and the posterior mediastinum. Talking about the contents, in the superior mediastinum, we have the thymus, trachea, esophagus, and the thoracic duct. We also have the aortic arch, brachiocephalic trunk, left common carotid artery, and the subclavian artery. In veins, we have the superior vena cava, brachiocephalic vein, and for nerves, we have the vagus nerve, the left recurrent laryngeal nerve, and the cardiac nerve. In the anterior mediastinum, we have the thymus, which is just in case of children, and smaller vessels. In middle mediastinum, we have the heart and the pericardium. We have the ascending aorta, pulmonary trunk and its branches, and the pericardiophrenic artery and the veins. We also have the superior vena cava, azygous vein, pulmonary vein, and the phrenic nerve. In the posterior mediastinum, we have the esophagus, the thoracic aorta and its branches, and the thoracic duct, the azygous vein, hemiazygous vein, and the vagus nerve. So here ends the first segment of the video on thorax. Our next segment of the same topic will be dealing with the trachea. Hope you liked the video, and if you did, please do like, share and subscribe to our new channel MediMadeEzy. This was our first video. We are open to any suggestions and any remarks. If you do have any, please do comment below. Thank you. Our next video will be coming soon.